Well, hello, everybody, and especially obviously the audience that's joining us for this podcast. The podcast is actually rather unique. It's following a series of not only publications in our SMJ journal, but also following our from students to residents, and actually now even in practice. And that's a program that was initiated here at the University of South Carolina School of Medicine in Columbia, initially called, and still for this podcast, called the VITP program, the Vertically Integrated Trainee Program. It's now been recently rebranded, and we're going to get to that. But just for simplicity, we're going to call this, or I'm going to call this the VITP program until the very end. And then we are going to discuss the rebranding, adventure, journey, etc. And it's now official. So we'll announce that at the end. Jennifer, thank you for having us as part of SMA, et cetera, obviously. And I know Randy Glick, I want to thank him, as well as the solid support that not only I have gotten through my career, as well as our students, our residents, and now our practitioners from not only the SMJ, the journal, where obviously this has been published now for what, 7, 8 years now over time, but also the SMA for their really solid support. And in conjunction with the PIT, the Physician in Training program that we're also going to discuss as well. And we've got the leadership from that. With that, I'm going to just now introduce myself. I'm Don DiPette. I am here at the University of South Carolina School of Medicine and University. I'm presently the Health Sciences Distinguished Professor. I'm also the former Dean of the USC School of Medicine in Columbia as well. I've been past president of SMA, so I've had a lot of privilege and a lot of honor to be involved, not only with these two institutions, but connecting the institutions and connecting the individuals, and it's been an honor. Before I start, and I want to ask everyone to introduce themselves, I want to say something it just dawned on me actually really last night when I started thinking and talking to myself a little bit about today. And what all of a sudden struck me is we have and had continual integration of our student leadership from undergraduate here at the University of South Carolina to the School of Medicine, if you will, into residency, and now even into the practice and the clinical arena. I think that is something that should be celebrated. And I think that's something that is obviously integral, and it's somehow the culture of the VITP program that we have these individuals with us today that represent, I don't know what we want to call them. We can call them eras, epics, cohorts, I don't know, but has seen it from the very first inception of discussing it on a napkin, if you will, to now 3 publications, rebranding, and further expansion. So with that, I'm gonna stop, and I'm gonna go by seniority. So here I go. We have Jaron Pettis. Would you introduce yourself and tell us a little bit about your background and your role and relationship to the VITP program?
Yeah, so my name is Jaron Pettis. A little bit about my background is I'm the first person in my family to ever go through medical school and become a physician and go through this process. I graduated the School of Medicine in 2019. While at School of Medicine, I met my wife, who graduated the year after me. And then we both did our residencies in New Orleans at the Ochsner Clinic Foundation, where I did general surgery, and then she did OBGYN. And now we're both in practice at Northwest Health in LaPorte, Indiana. And so it's been fun kind of being there from the beginning of this program, watching as it's kind of passed on and continue to grow and prosper.
Well, thank you very much, Jaron. Obviously, one of the initiators and of the inception of the VITP program. I'm going to turn now to Buckley.
Thank you, Dr. DiPette. My name is Buckley McCall. I'm born and raised in South Carolina, and I'm a graduate of University of South Carolina School of Medicine in Columbia in 2023. I was a member of VITP all 4 years and had the privilege to be the president kind of during this COVID era, which was not without its difficulties. I've gone on, I'm now a second-year internal medicine resident at University of South Carolina, Greenville, at the Prisma Health Upstate program. In my doing internal medicine and really enjoying that process. Looking forward to seeing what we've continued to do with VITP and as we go forward.
And Buckley, thank you too, as well as Jaron, for joining us today. Greyson, you're up. Tell us a little bit about yourself and your involvement, and how did you come to be involved in the VITP program?
Hi, my name is Greyson Fox Tran. I'm currently a third-year medical student here at the School of Medicine. I'm the immediate past president of VITP, still a member and still try to help out as much as I can.
Mhm.
And I actually went to undergrad here at the University of South Carolina as well, so kind of got a little bit of exposure to VITP as an undergrad and really saw how helpful it was and wanted to be a part of that as I came to med school.
Greyson, wonderful. And, family background?
So I'm originally from Charlotte, North Carolina. And my dad is a family physician and mom is a speech pathologist, so kind of was always around medicine and sort of discovered for myself that I really enjoy the medical field and wanted to pursue becoming a physician.
And obviously, lastly, but clearly not least, Logan and I have had a lot of interactions lately, especially this year. Logan, would you introduce yourself? And again, how did you become involved in VITP, and where are you now with the program?
Hey, so my name's Logan Hitchcock. I'm the current president of VITP on the medical school side of things. Grayson's been a great mentor to me. Thank you for that, Greyson, in leading the organization. So I was also a part of VITP as an undergrad, and it was very integral to me and, establishing myself, figuring out where to go, how to get into med school. And that's why I wanted to join as a mentor and pay it forward. I actually think I would have been in AED as an undergraduate around the time when Buckley might have been the president, on the medical school side of things. And my family background, so I actually come from a long line of nurses and then first generation physician, hopefully aspiring on the right track so far. But I grew up around healthcare. I was a kid wandering through the hospital with my mom. When she'd work night shifts, she'd have to take me in there. So I was exposed young and just kind of always knew I wanted to go into healthcare. Got into college and realized I wanted to take the physician route.
Well, we are very glad you did, Logan, and thankful to your mom. Not only we're physicians, of course, but obviously this is a team. This is a team sport. This is not golf or tennis, and the whole team is important. And we thank your mom as well, not only for introducing you to healthcare and medicine, but what she's done, surely. Before we get into VITP, and I would like to actually start that process, Logan, you did it. You mentioned another word, another organization, AED, Alpha Epsilon Delta. We asked one of our students, or a few of our students, if they could join, but unfortunately they're students and they're really, really, really busy, busier than we are probably. But you mentioned AED, Logan. Tell us a little bit about AED and its relationship to VITP and how it links obviously our undergraduate students with our medical students, and obviously our attempts to link with residents as well.
So AED Alpha Epsilon Delta is a national pre-health, pre-professional fraternity. And then I was at the USC chapter. I joined, I believe, my junior year, spring semester, so a little late in the game compared to most people. But the overall goal of AED is to just bring everyone of different healthcare professions together, starting in undergrad, cultivating that teamwork, community culture. And so you have pre-PA, pre-PT, I believe speech therapy is in there as well, pre-physician, pre-dental, just all different backgrounds in healthcare. And then VITP specifically is a subset within the organization geared at helping pre-medical students find their way, find their footing, get exposure, gain mentorship, and just learn lessons that'll help us get into medical school and further our careers so that we can pay it forward when we're, farther along the track.
That's absolutely wonderful. And I did want to absolutely get a shout out, if you will, to AED and our undergraduates, because actually, since I've been sort of like tagging along this entire process, it was the undergraduates that really were clamoring for more support, more help, more connectivity, if you will. And again, not only just in medicine, Logan, you really spread it out pretty well, including even public health. So it really came from our undergraduate students linked to our medical students. And of course, Jaron and Erica were some of the early, obviously, champions, if you will. So thank you, Logan, for that. And for the shout out to AED Alpha Epsilon Delta, our pre-health, or like you said, pre-professional honor society. It's national. So many other universities obviously have really robust and outstanding AED chapters and programs. I'm a member of AED just by coincidence as well. And like Jaron, I'm a first gen. I didn't know that until someone in San Diego told me, Dr. DiPette, you're a first gen. I said, well, what's that? And then they taught me that, yes, I'm the first person to go to college, and then first person, obviously, and still the only person to be a physician. So I share that with our students and whatnot. Let's turn our attention now to VITP. We've been mentioning that name, quite a bit, but I guess anybody can shout out. Of course, Jaron, you can go first since you're here the longest. What is VITP? What embodies it? Obviously, we've already sort of mentioned AED. How did it come about? And I guess we could discuss mission and vision just briefly, but also, I just want to hear from you all. What is VITP, and what does it mean? And then we'll talk a little bit more about what it does, where it's been, where it's past, present, and future.
Yeah, so VITP stands for the Vertically Integrated Trainee Program. So it kind of came about at one point, I was very fortunate to have Dr. DiPette as a mentor when I was in medical school. He kind of helped walk me through the whole process and kind of really is kind of the foundation to how I kind of got to where I am now. And we were having coffee one day, kind of, we used to kind of do that every so often just to kind of catch up, see what things we could do, work on kind of the papers we're on. And we were chatting, and he was kind of like, he brought up the question. He's like, what do you think was kind of missing in kind of your process that you wish you had? That's when we kind of started talking about, I didn't have any exposure in undergrad to really any medical students, any residents. I had a couple of physicians that lived in the neighborhood that my parents were in, and that's kind of like my only exposure I had. And I kind of, based on my background, I had no family members that have gone through this process, and really it was kind of a mystery, and it was a challenge to get to medical school and keep going. And so we were chatting about kind of starting up a program where we can kind of start exposing and making that exposure to people. And so through that process, we got the Columbia Medical Society involved, the Southern Medical group, and kind of through the different leadership within the school as well as the AED program, we kind of came up with this idea of let's start introducing, kind of making these bonds and formations. But the biggest challenge kind of moving forward that, we kind of saw when we started this program was how do we keep this going? What do we need to do to kind of keep interest going, continue to have leadership and people jumping in? And that's kind of where it began, where we, in order to kind of get growing interest, we tried to make it a group effort amongst the school. We had the whole student body at the South Carolina School of Medicine kind of reach out and kind of pitch ideas as to the name, which is how VITP came to be, as well as our motto, which was today's students train tomorrow's physicians, and ultimately our kind of mission statement, which was a society to integrate through communication and collaboration the training levels consisting of undergraduate students, medical students, and postgraduate students and fellows in order to kind of make this a transition process, because along the way, we're always still learning. And, on each step of the way, it's good to have mentors along the path.
Wonderful, Jaron. And it is amazing that obviously we're here today because of those initial discussions and initial involvement, not only of the medical students, which was robust, but also our undergraduate students. And obviously that came from the leadership from AED. Buckley, what does VITP mean to you and your perspective?
So I did my undergraduate education at Clemson University, and I was not a member of AED. I was a member of different, pre-professional health fraternities, et cetera. So coming into medical school, I wasn't very familiar with the process of AED and VITP, and it was at the club fair initially that I saw, hey, this is a mentorship group, might as well get involved. And then it began to form into this. VITP just represents opportunity. to me. It is allowing not only medical students, but also undergraduates and residents be involved in something kind of bigger than ourselves. And it is allowing for these undergraduate students who may not have had the opportunity otherwise to get involved with the medical students, to see the campus of a medical school, to go through training simulation, admission simulation, all these different events that I'm sure we'll talk about later, allowing them access to that they would not have had otherwise. And I think that that's really an invaluable asset to have when you're going into medical school. It's definitely something that can be easily spoken about in terms of applications to get into medical school and interviews. And then additionally, along with opportunity comes mentorship. There's value in mentorship, not only to the mentee, but also to the mentor, being able to be somebody who is taking on not a burden, but able to help a mentee and to be there for them is something that you're going to need to have and that skill for the rest of your life. So starting this early as a medical student, before you're a physician, before you're a resident, and being able to act as a mentor for somebody, I think is also really valuable. So big picture, it's about opportunity and mentorship for me.
Wow, wow, Buckley. Greyson, your thoughts, and then of course, Logan, we're going to turn to you.
I agree completely with what has been said already. They've kind of hit on definitely the highlights. But similar to Buckley, I found VITP during our medical school's student organization fair, and I recognized AED immediately because I was a member of AED in undergrad, and I just like going through the whole process of being pre-med, like so many people do, is you look for mentors, you look for help, because it's a very hard, very complicated process. Even with someone who has connections to the medical field, it's always changing, and you just want to be as up to date as possible. And I just really like the idea of being able to pay it forward, because as a medical student, you may not feel like you know very much, but you've made it to medical school, which is a huge first step, and wouldn't have made it here without all the mentors and teachers and great help that we've received along the way. So being able to sort of pay that back, especially to other people that may not have some of those connections or experiences, and just try to help people push along the path to medicine, because we need more doctors in this country, and
Wow.
it'd be great if we can really help people as much as we can.
Logan, I think your thoughts are going to be the most important, not to obviously negate the other ones that we heard. And the reason I say that is you're in it now. I mean, you're the president now. You're obviously the youngest, and hopefully it's got the most potential to influence you now. Logan, your thoughts?
So as Grayson said, I completely agree with everything that's been said before as well. And I'd say the most important thing that's been said to me is the paying it forward aspect, because I remember being an undergrad, something my mom always told me, she would introduce me to the healthcare field, but she always told me like, I can't help you along the physician path. She doesn't know it. She never experienced
Wow.
it. She can help me shadow and everything and garner connections there, but she physically can't help me with the application process because she's never experienced it. So AED and then specifically VITP were so instrumental to me in exposing me to people who had been through the process, succeeded in the process, and then passing along what they learned through their experiences to me, instilling confidence in myself when I was that scared little undergrad who didn't know how to, pursue his own goals. So I just try to remember all those feelings I had back then and channel that into wanting to be a mentor now.
I can see our youngest member of the VITP program and or the rebranded form is already here with us and participating in the session, and it's just wonderful to see. I can't even talk. It's so wonderful, since obviously I've known all of you. I'm going to throw it out to the group, and I think you've kind of like touched on it, but I'd like to maybe make it a focal point for a minute or two. What makes VITP unique? There are many organizations, not only on the undergraduate, but in the medical school. I mean, I see the bulletin board, and there's many organizations where, students can wonderfully participate, et cetera, and grow and take leadership roles. So why VITP, and what makes it unique from the other organizations that are around us? Anybody, go ahead.
I think from my perspective, one of the things that's made it very unique is the how much control of it comes from just the student body itself. you know, it wouldn't have survived to this point if there weren't people that are passionate about this program, have like really stepped up and taken the leadership roles and keep pushing this program forward. I was with it kind of near the beginning in its inception, but it's been amazing to watch how this has continued to keep going. It's gotten bigger, and just kind of hearing all of your stories about how you're inspired from an undergraduate level to now being in medical school, and then soon to be in residency and out in practice. And so I think that's one of my favorite aspects that makes it unique, and kind of watch how it's kind of really the idea has become true, where it's really kind of reached out to all levels.
Anybody else? Any other thoughts on what makes it different or unique, et cetera? Although I know we've already touched on many aspects. We just haven't put it in that little bucket, if you will, the uniqueness bucket.
I think one thing that really comes into play is, yes, it's about medical students, residents, fellows, undergraduate students, but within the program itself and within, I guess, the leadership itself, the familial aspect of it. Ryan Alexander was the president before me. Bryce Jaron was the president after me. And then Greyson was after Bryce. And then I can text any of these people at any point. If I need anything or have questions, I know Greyson reaches out to me about things. So I think that's a really important aspect. And one of these things that Jaron's talking about that has kind of kept the program going is you're not really handing things off to a stranger. Everyone is like-minded, and everyone has the same goals and wants the ultimate best for the VITP. So I think that's something that's really kind of kept it afloat and differentiates it from other programs.
And in addition to uniqueness, again, Logan, Greyson, what motivated either of you or all of you to become part of VITP? Because just like there's many other organizations, and VITP has some unique qualities to it that differentiates them. Why VITP to participate? Because you also had the opportunity to participate in many other organizations, both at the undergraduate and graduate level, and obviously now even the residency level. Why?
So kind of going off what Buckley said, just like that aspect of community and knowing you can reach out to anyone. But I think another really unique aspect of VITP is that it's not only med student led, but it's also undergraduate student led. And I just really like that it's sort of an open conversation and a very, very unique organization in that it's not just like the med students telling the undergrads what to do. It's a collaboration of everyone coming together, and it's like, what are your needs? What do you want? What do you want to learn? How can we help you? And just really working together and trying to make it an open discussion, because so oftentimes in everything, it's almost like people are sort of talking down, telling people exactly what they need to do to get where they need to be. But with this open discussion, it really kind of breaks down some of those barriers. It can make it a lot less intimidating, especially to anyone who's got no exposure to med school or becoming a physician, and to just any undergrad in general. It can be really intimidating to talk to a med student, a resident, or a physician. But when you just make it an open discussion, it really allows great productivity to come forward, and the best things happen for the organization.
Thanks. Thank you, Greyson, for that. Logan, I want to talk to you. The M word has already been mentioned. So what's the M word? Mentorship. Mentorship is key. I'll say from even my perspective in watching over the years has been a key brick, if you will, or foundation or pillar of a VITP. How has that been possible? Because I hear constantly, it's difficult to find mentors. Yes, maybe it's a relationship, but it's superficial. They come and go. How has VITP been so successful? And then I guess the corollary of that is, what role does that play? Not only in the daily, lives, career aspirations of our participants in the program, but also, burnout is a big issue nowadays, and as it should be, because it's very, very serious and it's a real thing. But anyway, a lot of thoughts in my head that are so I got like flight of all these ideas. Help me, Logan, put some of this together.
Yeah. So I think first of all, to address, you mentioned, how are we able to sustain and continue success of, providing new mentors, just replenishing that pool of mentors. And I think the reason is, I shared my personal experiences earlier of what motivated me to join this organization. And I think just, acknowledging what we gained out of it when we were a little lower on the totem pole, a little earlier back in the track, acknowledging how we grew from this and from our mentors and just wanting to pay it forward. And then also in terms of preventing burnout, I think it's really important to stay involved in mentorship for me personally, because I can see, where I maybe used to be, and you can see how far along you've come, how much work you've put in, and, try to help someone do the same for them and spread their wings. So it's just really nice to stay involved throughout the whole process of becoming a physician and not getting bogged down in just where you're at and what you need to do. So it's just provides a great perspective.
Wow, Logan. So it's sort of like a big umbrella, if you will. There's a mentorship umbrella. There's obviously relationship umbrella, and those umbrellas are critical. And it's I guess it's amazing that they're not that plentiful. And even if they're there, they're not easy to identify. It's difficult to maneuver through undergraduate at all these organizations, et cetera. And one thing that I've watched is that the VITP program makes it easier, if you will. It's not cookie cutter because it's all individual, but it seems like it makes it easier to traverse this path, whatever this path, wherever it takes you. And obviously, it's our goal is to make everybody just better, a better person, a professional, and make their dreams come true, if you will. We don't have medical students with us. Again, I already mentioned we asked, but we're going to get them. We still have a to-do list to do. But what advice would you give our pre-medical or our pre-health medical students that are going to listen to this podcast from all of your perspectives in terms of if they were right here with us, what would we tell them? What advice would you give them?
I think I would tell them that take any of the help that you can get. If there are opportunities available for you, especially if they're free or easy or cheap or just it might mean, oh, I have to go to a meeting at 7 p.m. when I'd rather be sitting at home in my apartment or dorm doing other work. But I think it's really, really valuable when you have people who are willing to spend their time to provide more information and help you to just say, yes, like I will listen. And then the things that you will gain from that and the opportunities that you'll gain from just kind of showing up are really, really helpful. And it's more than you would think.
Any other thoughts on that, on advice for our undergraduate students?
I would say don't be afraid to reach out for help and don't feel like you're ever a burden on anyone. I think a lot of people are very excited to offer help and guidance, and for kind of being on the other side as kind of helping other people through it, it's very it helps me out too, being a teacher and a mentor, and I've always enjoyed it and I look forward to it. I love the relationships I make. But I remember when I was in undergrad, I felt like it was always kind of like I didn't want to be a hassle to anyone reaching out and kind of connecting with people. But being on the other side of it, that's not the case. No one ever sees it as being a hassle or a problem. Like we're always excited. We look forward to it. And I've made some great relationships and connections along the way that I have today.
Logan, your thoughts.
I'd also like to add in on that. Just from a confidence standpoint, maintaining your confidence is just always remember and acknowledge that there are a million different paths. I remember a problem I had was I try to compare myself to others a little too much. And it's very important to realize like you're running your own race. You're garnering your own valuable experiences in your own way, doing things that you love. It's probably the biggest point of uncertainty in your life, potentially, at least thinking about your career as a pre-medical student, and at least it was for me. And I just think it's really important to, remember, as long as you're putting some work in, doing things you love, you are garnering those experiences, and just try not to beat yourself up too much when you're at that point.
I think that's important. And I liked that a lot, Logan, because we can be our worst enemies and we can be our most critical, individuals. Forget other people telling us we can do things better. We are constantly telling us we can do better. And that just beats us up. And somehow That advice is well taken. And if there are our medical pre-medical students or our undergraduate students, as you're watching this podcast, please listen to us or listen to the thoughts today, because you can do it. And you can do it because you're good, you're worth it. And there's a lot of help around you, but it's intimidating to ask for that help. So, start small, ask a little bit, then more and more and more and more, but keep asking. Greyson, what are some of the biggest challenges? Still centering on our undergraduate students that undergraduate students experience, I guess today. There's been challenges through every decade, every generation, but specifically to our students today.
I would say some of the biggest challenges facing our undergraduate students today, at least a big one for me was when I was undergrad, COVID actually hit, and that was threw a big wrench in things. And I think just in general, as an undergraduate student, you never really know what's going to come your way, and just in life in general, things can get thrown off. It can be hard, like opportunities can get thrown out the window. I think just being able to deal with the challenge of uncertainty and not knowing what you should be doing and what you need to do to get to med school and which opportunities are good and which opportunities are bad. I think sort of going along with what Logan said is just kind of follow your passions and do what you really enjoy, because that can really help prevent burnout and prevent a lot of anxiety, and it can be really intimidating to feel like you have no idea what's going on and not sure what you should be doing. And so if you just find something that you enjoy, like a certain volunteering or a certain leadership or a clinical experience that you really like, and just stick with that for as long as you can, I think that can really help you overcome the challenge of facing uncertainty.
Is it possible, and I'm going to just throw this out to the group, is it possible that VITP could be useful in bridging our students, whether they're undergraduate students, medical students, across cultures? And there's even age differences amongst our students now. There's younger students, there's older students, and we welcome obviously the diversity of age, obviously race, ethnicity, et cetera. How can VITP help that or approach that?
I think, of course, everyone's looked at equally from a medical student to undergraduate to resident to fellow perspective. Anyone, from my understanding, can be in AED.
Absolutely.
And then within that, anyone can say, hey, I'll take these opportunities provided to us by AED and work with the VITP and just show up. And then when people show up to these events, we're not going to treat anybody differently based on if they're 37 and just moved to the United States and are looking to establish a career in medicine, or if it's 18-year-old freshman in college who's just been really passionate about it and grew up in the medical field. We kind of pride ourselves on providing everybody the same opportunity and then allowing everybody to join in as long as they express their interest. So I think that's one of the valuable pillars that VITP and AED both stand for.
Well, Buckley, that's wonderful, and I really hope, and I know we do, and it's actually one of the most rewarding things that I've watched. I join in the room, but I kind of like try to stay away a little bit. I just watch the room. From my perspective, again, not only my generation, my age, et cetera, but that's been stunning to me. It's been stunning to me to see the interactions between whatever room we're in, whether it's an undergraduate room, medical school room, mentoring room, mock interviewing room. It doesn't seem to matter. I have just been incredibly impressed with not only the collegiality, but the engagement of everybody. And like you said, it doesn't matter who walked into that room. Your family, your VITP family in that room. And I can't tell you how warm it makes me feel when I see all of you in this forum. And I've been looking at it from a different perspective over, the eras, if you will, that we've talked about, the 6, 7, 8 years now, and it's been startlingly consistent. There's been no breaks in that. There's been no cracks in that. Some of you have mentioned some specific events. What are some of the events that VITP, in conjunction, obviously, with AED, have held that were most fun for you or most rewarding or practical?
I would say that at least one of my favorite events, and I think a lot of the undergraduates' favorite events, is we do an ultrasound workshop with the
Oh,
undergraduates. I think that's a really unique aspect of the medical school here and just our VITP program in general, is that we have a huge emphasis on learning ultrasound to really reinforce concepts, especially throughout anatomy and physiology during our M1 year. And I think it's a great experience for the med students and the undergrads where in our ultrasound workshop, the medical students will sort of show the undergrads what they've learned, how to use ultrasound and different scans they can do, and then essentially let the undergrads sort of play with the ultrasound machines and scan each other, scan the med students, and kind of talk them through what we've been learning. And this just kind of goes along with your path to becoming a physician in general. The best way to learn is to teach others, and I think it really helps the med students reinforce what they've learned with ultrasound. And it's just a cool tool to show the undergrads like, hey, this is just something you get to use as a doctor. That's just a really cool piece of technology that's integrated into our field.
well, this is going to scare Jaron to bits, but I remember in my surgery rotation, they said, see one, do one, and teach one. And I don't know if that still holds true or not, but it scared the heck out of me.
It's still
When I
very
said,
true.
wait a minute, I got to teach one of that. I have to do one of these. I got to see one of these. No, 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 don't make me do it. Yeah. Jaron, some of the events that you enjoyed or that were more meaningful. Yeah.
Yeah, so kind of at the beginning, it was kind of a challenge of how do we kind of initiate this engagement between AED and kind of the medical students. And so I remember the first event that we had was our speed dating event, where we tried to basically match up. I think we had like 30 or 40 medical
You
students,
did.
and then we had like almost 100 AEDs, and try to how do we get everyone to see, and then kind of pair up and make these mentorships. So I remember that one's kind of iconic to me since it was the first event we ever did.
Yep.
But I remember some of the following events like panels for like working on like doing mock interviews and kind of setting up or kind of like resumes. I remember those were always ones that were pretty highly enjoyed.
Got it. Yeah. Any others that were particularly striking or valuable?
I'd like to just add on to a reason I love the ultrasound workshop we do also is, you know, we're teaching something new to these undergrads that they've never seen. And I think that's really important in fostering interest in the field for these undergraduate students, because that's part of finding your career path and advancing along your career path is being sure that it's something you want to do. So, you walk into an ultrasound lab, maybe it's a light bulb moment for some of these kids,
Yeah.
that sparks their interest and they're like, yes, this is definitely what I want to do. And the entire time, it's such a laid back environment that I think that's really important in breaking the barrier between us and them, breaking that barrier and bridging the gap, making them more comfortable, speaking to us, asking for the help. So I think that's one of the more important aspects of the ultrasound workshop and similar events.
Logan, thank you very, very much for that. Buckley, I'm going to turn to you. We're going to start wrapping up, and I want to give everybody a heads up. We're going to start talking about the branding, the new branding efforts. But before we get to that, Buckley, how does VITP relate to the PIT program, the SMA PIT program, the physician in training program? Obviously, you lead that now, and you've had the experience of both. Both worlds. Similar, different? Can they work together? Should they join? Thoughts about that, and tell in the process, tell us a little bit more about PIT.
Okay. Like Dr. DiPette, like Dr. DiPette mentioned, I am now the chair of the Physicians in Training Program for the Southern Medical Association. And that all, I guess, incepted because through mentorship, Dr. DiPette told me one day in hypertension clinic that the Southern Medical Association was starting this program to help recruit new members and younger members, and that I should join. So I filled out a Google form and became a member of the committee for the Physicians in Training. And that was when I was a third-year medical student. And then I've stuck with it. I guess that was 4 or 5 years ago. Now I've stuck with it and have become the chair, and we're hosting our annual conference, the Physicians in Training Conference, at UAB the weekend of February 7th. So that's exciting. I see a lot of similarities within the Physicians in Training Program and the VITP, mainly because it is about establishing the youth and the up and coming physicians in our country and saying, okay, here is opportunity for you to become involved. Here's opportunity for you to kind of figure out, is this something that I'm interested in doing? Generally speaking, physicians in training specifically works with medical students, residents, and fellows. And we primarily work on getting people engaged, working on making sure that there are good resources that the Southern Medical Association can provide to these members, and then also allowing for people to present at two different conferences, whether it be the Physicians in Training one or the annual scientific assembly that the Southern Medical Association hosts. And how that relates to VITP is that it's all about these programs that are helping students decide if they want to do medical school or decide what kind of residency they want to do, and then letting them learn that and figure that out for themselves with a little bit of help. We've talked a lot about combining the two over the last few years. And we've tried to use, or at least I've tried to use my platform with the Southern Medical Association to open more branches of VITP at other schools using the breadth and the reach that SMA has to kind of create these mini VITP programs at other places. We've become somewhat successful in creating many SMA programs at these locations, but we haven't necessarily been able to brand it as VITP.
And Buckley, I'm not disappointed in that. I don't know if they don't necessarily have to join. I think if they do, fine. And if there is an institution that wants it that way, absolutely, we should facilitate it. But more important to me is I want them to know each other. I want to know the uniqueness of each, how they can help each other, how collaborative, versus independent, if you will, or interdependent. But I would urge us to continue seeking collaboration between programs like VITP, PIT, et cetera, because the ultimate goal is the same. It's to help all of us, no matter where you are in your career. And you all help me every day that I interact with you. Trust me, I could go on and on and on, but we have limited time for this podcast. Let's start thinking about, and this one actually surprised me when you came to me about several months ago and discussed potential rebranding VITP, the initial VITP, Vertically Integrated Trainee Program, to something else. What spawned that? Where did that come from? And now I know the answer. How did it come about, and what is the new brand? So why, what, how, and we can then start wrapping up.
Sure. I can sort of speak to why we started considering the rebranding. I'll sort of hand it off to Logan after that. So in analyzing the organization with our most recent publication, we were trying to assess how we can get more undergraduate students involved with the program. And what we found is that because AED is a pre-health organization with so many branches within it, with, like Logan has said before, like the pre-dental, pre-PT, pre-everything, it's become so big, then they've sort of almost mimicked the VITP program because it's been so successful. I think it was the first program of its type that AED had, where it was specifically focusing on pre-meds, but they now have similar programs where PT students will help mentor the pre-PTs, and pre-dental or dental will mentor pre-dental, and so forth. And so we found that there's sort of becoming confusion as to all these acronyms that they have within AED as to what's what. And for a lot of the undergrads, they were in AED, but they didn't really know what VITP was. It wasn't being communicated clearly. So we wanted to rebrand so that it was clear that VITP is for pre-meds, and that we want as many pre-meds and every pre-med to join if possible. So I'll kind of hand off to Logan for the rest of it.
Yep. So just to reiterate that, yeah, I believe the goal of the new branding was to make it more clear what we were and who we're trying to connect with. And we ended up going with our new name is now MedConnect. We met with our undergraduate representative, Izzy Chappell, came up with the name together, and that's what we decided on. And I just believe that clearly, demonstrates like we are trying to connect the medical profession. I know originally the name, I think, was stated our mission clearly, vertically through the field, undergrads to medical to residency. But I think MedConnect's just a little more straightforward, if you will, just more cut and dry. I love VITP, by the way, not not discrediting that name at all. But yeah, so MedConnect is what we now are.
And again, as one that's kind of wedded to VITP, of course, and Jaron, we must be having an MI, and we're going to need a cardiologist, both of us. But I think that's good. It shows growth, it shows insight, introspection, and we always want to improve. And again, this was student led. This was, student, resident, undergraduate and medical student led, and that's what the VITP is all about. And it just shows that it's sustained with the rebranding. So today, I guess we're announcing, we've already talked about it, that VITP is now MedConnect. And I thank you, Logan and Greyson, thank you for giving us the reasons why. They're important. They're obviously for the future. And you know what? Another group may sit down at a table, a couple of years or years from now and say, wait a minute, we need to rebrand again. And if they did that, that's absolutely welcomed. And it just shows that the foundation of VITP now, MedConnect, is solid and it's there. Let's conclude with one other thought before we talk about final thoughts and a summary. What are some of the challenges? We've talked about all the good. We've talked about all that worked with VITP now, MedConnect. What's some of our continued challenges?
I can't speak necessarily to continued at this moment, but during my COVID tenure, I think that was a really challenging time to make sure that VITP at that time kind of remained in action and continued to do things. So kind of transitioning everything that we would have, whether it be the social or the clinical skills workshops or the panels that Jaron was talking about, all to kind of a virtual, stadium. And then making that jump and having people still come, because it's hard. People don't really necessarily want to come to virtual events. You don't necessarily have the camaraderie that you would have at the in-person socials that the VITP would hold. So that was a difficult challenge, but I think that we added extra things in, like trivia nights or Jeopardy nights, that would encourage more participation and kind of carried us through that time span. So I think just the adaptability of the organization as a whole, even beyond COVID, helps to kind of maintain this, and that's a challenge in and of itself.
What would be some of now this is for anybody listening that's external to MedConnect, whether it's SMA or some of our podcast listeners, what type of help or further help would MedConnect, including PIT, could they use? I guess I'm being very ambiguous, et cetera. Obviously, I'd like somebody to endow us. That would be great and give us tons and tons of money to do all kinds of fun stuff. But what kind of help could we use and or look for?
I think something that's been talked a lot about throughout the whole process since the founding of VITP is sort of really integrating undergrads to med students to residents to physicians. And it's challenging because obviously everyone's got a very busy schedule, especially residents and attendings. I think it'd be great if we could have more resident and attending volunteers to sort of come up with some new events that really integrated all levels of students and trainees at this point, because I think it would be really unique. It's obviously great to have the camaraderie between the med students and undergrads as we're close in age, but having resident physician involvement could be great for undergrads and med students to sort of see where the path leads and help them explore further what their career might look like.
Well, I'm going to go right to the two that were past resident, recent past resident, and resident now. Jaron, Buckley, that's been a thorn in our side from the very inception. We easily connected. I mean, easier than I thought imaginable with our undergraduate world and our medical school world, but we still continue to have we've had successes. I don't want to say that it's all been for naught, but we've had more difficulty doing that last vertical step, if you will, in the trainee arena, and that is residents. Thoughts on that? And how could we get help to do that, and or maybe continue to just work harder?
Yeah, an idea, at this point, the VITP, now MedConnect program, has had we're going on about 8 years of kind of involvement. We've got this pool of basically students that start at the undergraduate level, going into the medical school level. Now we're in kind of the resident, and then I'm probably kind of at the top end now at the attending level. And so I think this is a great database of like people that we can reach out to, get involved, see what things they can do to contribute to kind of help kind of offer that next level of guidance and mentorship. I was very excited when I heard about that this is still continuing, and when Dr. DiPette and y'all kind of reached out asking if I would help out with the next paper, it was kind of just an honor to be able to get involved again. And I would love to keep doing that. If there's any way I can kind of, as an attending now, kind of help out with that process, let me know.
Absolutely. Absolutely.
I'm always
Buckley,
available.
you're in it now.
I'm in it now and I'm here. I think the hardest part as residents is when you have free time and when you're available to do things like help out with VITP and mentorship and education, it's very little and kind of few and far in between. So doing that takes away from time that you would maybe be spending with your family or whatever you like to do in your free time. So it's not easy to make that commitment. And it's also not easy and very difficult for anything like the VITP or AED to incentivize residents, because we want people to kind of be there and say, hey, I'm here volitionally. I really want to be here and help out, and not being kind of like a paid mentorship. So I think, like Jaron said, reaching out to those people who've been involved in the program, maybe not necessarily as leadership in VITP, but we're just a member of the organization or who are in AED, and kind of getting those logs of people who existed in the past and saying, hey, where are they now? Do we have a good contact list that we can reach out to, and reaching out and involving those? Because a lot of this has said, we want to give back. We've all kind of experienced mentorship in one way, shape, or another, and we are now looking to give back. So I think reaching out to those contacts, not necessarily leadership, but people who've just been on the benefiting end or on the giving end of these ideas and mentorship would really help us garner more involvement from the residents and attendings.
Wow. Again, Buckley, thank you. Again, I think we still have to put our nose to the grindstone here, though, with our residents and try to connect. And now we'll do MedConnect. Connect our residents, and if it's difficult, fine. That's okay. And I understand. But any little effort we can do, that's one where I would wholeheartedly support. Time is short. Final thoughts, words of wisdom. We just want to throw out the forum for anybody else. Any gaps, anything we missed today, we can always do another one. And I'm going to say all the thank yous in a few minutes. But final thoughts.
Just want to say, kind of emphasize again how proud I am of kind of where this program has come. It's thanks to you all that have continued this after I left, that, it's really just grown and expanded beyond what I initially envisioned. And it's been fun to see kind of how it's changed and progressed along the way. I love the new name MedConnect. I think it's kind of keeping up with kind of the advantages or like the changes that we're seeing. And, it just kind of reaches back to the core of it where it's student led, it's your project, I handed off the reins, and, I love when the next person comes along and they say, let's make these changes, and it's just, that's how it grows, and that's how we'll continue to grow and keep getting passed on to the next generation.
Any others?
I think just staying involved is really important. And that's as a resident, medical student, undergraduate. Showing up, being there, and MedConnect allows you that opportunity, allows you these events to go to meet people. And I would just really encourage, if you aren't aware of the program or haven't heard anything about it or don't know of anything similar in your area, to look into it. Or you can always reach out to, I assume, any of us, and we can get you in touch with the right people if you're interested in starting a similar program in your area. And I think that's could be really valuable going forward. But just doing things and being involved is critical.
Well, Buckley, that's where I think Pitt could come into play, as well as we thank the SMA and obviously the SMJ umbrella for those that we didn't specifically mention it. It's been in passing, but 3 publications outlining the progress, if you will, from its inception of the VITP, now MedConnect, have been published in SMJ, and it's amazing. And I know there's a 4th being planned right now. And I just can't thank all of you for leadership. Those of you that couldn't join us, I thank you too. Everybody knows who they are. And Jennifer, thank you very, very, very much for being the conduit, the contact person, the convener, if you will, for getting us together and giving us all an opportunity to discuss VITP, now MedConnect, its connectivity to Pitt, and obviously to SMJ. And the generosity of the SMJ journal as well. I know it's peer reviewed, et cetera. So obviously they get in for a reason, but we still thank you.
Well,
and I want to thank our
from the journal
audience.
side. I've been the managing editor for, I'm going to say, longer than some of you have been alive almost, but to watch the evolution of the publication and how it has grown and how it has evolved, and to kind of see where we started. I remember that first publication was in 2019, and now to see it coming forward and to have it grow and what's happened. And so from that perspective, and just know that from the SMA and the SMJ, we are here to foster physicians as they start their journey, as they continue through their journey. We are here however we can, and are honored to be a part of it.
Well, with that, let's conclude. I want to thank again everybody for today. Time is valuable, as you've all talked about, and you gave time, not only from yourselves, but your families, et cetera. I thank you for that. I thank you for the continued help and work on MedConnect, and I'm here also to be available anytime you need me. Again, I thank our audience, and if they want to know more about MedConnect and Pitt, they can obviously contact us, and we will have those connectivities available for everybody. Thank you.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.